Hello and welcome to this demo. Thank you so much for joining us today. What I'm going to walk you through is IntelliSense IT's clinical management system, and more importantly, how it has been designed specifically to support the way hospices. It's a platform that's built around the realities of palliative and community care, where coordination, compassion, and continuity matter just as much as clinical accuracy. At its core, this system brings everything into one secure place. Referrals, patient records, clinical assessments, safeguarding, scheduling, documentation, and reporting, so that teams are no longer working across disconnected systems or paper-based processes. Instead of information being spread across inboxes, spreadsheets, and individual notes, the entire patient journey is held together in a single shared view that the clinical and support teams can rely on. The aim of this demo is to show you how the solution can fit naturally while giving you stronger visibility, consistency, and confidence across your care delivery. So let's begin with how the system handles the first point of contact, which is usually a referral form from a GP, a hospital team, a district nurse, or any other clinical partner. Referrals arrive through a secure form on the hospice website. Using a Microsoft form, we can capture the essential details needed to act quickly: the urgency, the source of the referral, the services being requested, and a brief summary of the presenting situation. If the NHS number is provided, that positions the system to connect with the national clinical records in later phases. Before submitting, the referrer can review the hospice's privacy information, which keeps the process transparent and compliant right from the first point of contact. Once the form is submitted, the referral appears immediately on the internal triaging dashboard. You can see the new record here, clearly marked with its urgency level. High priority cases show a visible countdown timer so that nothing slips through unattended. The referral includes everything supplied earlier: patient details, background notes, and the initial request for support. From here, the cases can be reassigned to the appropriate nurse or coordinator with a single action. Nothing gets lost in the email chains or hidden in individual inboxes. At this point, the team often needs more details to make an informed decision. The system supports this by sending out detailed clinical questionnaires. You simply trigger the long-form request, and the referrer receives an email with a secure link. That extended questionnaire captures the broader information hospices rely on to plan safe care. This includes current diagnosis, symptoms, medication, allergies, mobility levels, daily living considerations, and any existing risks. It also captures information about the people involved in the patient's lives, like primary carers, next of kin, siblings, and partners, and their contact details. This ensures that when the patient is accepted, their full support network is already structured in the system. These relationships can then be used to build a clear genogram around the patient, and that becomes important for safeguarding, communication, and bereavement support. And again, GDPR information appears on this form as well, so everyone entering the data understands how it will be used and stored. When the long form is submitted, it flows straight back into the referral record. There is no need to manually rekey information back in. You also don't have to reconcile information across emails. The team now has a complete picture in one place without any manual data entry or document chasing. Once the triaging team reviews the detailed information and confirms that the patient can be safely supported, they mark the referral as accepted. This is where Microsoft CE does a lot of important automation behind the scenes. The system automatically creates the patient record and builds the link contacts for each of the family members or carers. The moment the referral is accepted, a new episode of care is also generated, and this becomes the central workspace for everything that will happen during the patient's time with the hospice. Additionally, when the referral is accepted, an automated email is sent back to the referrer to confirm that the hospice has taken the referral forward. The same applies if the referral is not accepted. The referrer is informed automatically, ensuring clear and timely communication at all times. Now I'll shift the demo into the episode of care view. This is the part of the platform the hospice staff will use daily. You can see all the demographic, clinical, and household information already appears here without anyone needing to rekey it. Episode opens with the set of assessments that the hospice team will carry out. Some of these are daily, some weekly, some monthly, and all can be tailored to your own clinical pathways. For example, you might have daily observations for blood pressure, oxygen saturation, temperature, pain score, medication adherence, hydration indicators, and mood. When the staff enters today's observations, the system compiles them below so you can compare how the patient is progressing over time. If there's any sudden temperature spike, a rapid drop in appetite, a decline in mobility, or a pattern in pain escalation, these trends become visible instantly. This helps clinical teams make timely decisions and gives governing bodies like CQC the auditability that they expect to see. If the patient is being admitted to the inpatient unit, you can assign the room and bed right from the episode of care, where a patient is admitted for inpatient care and a bed, a chair, room, or other resources assigned. The system automatically marks the resource as occupied. This gives the team a real-time view of the capacity across the hospice. Equally, when a patient is discharged, the resource is automatically released and marked as available again. This removes the risk of double booking, supports safer bed management, and gives operational teams confidence that availability information is always accurate. You can similarly assign the key worker, who becomes the main point of contact responsible for coordinating care, communicating with the family, and keeping the episode up to date. Key workers can also set the risk level. For example, if the patient is a high fall risk or has complex behavioral or cognitive needs, and the system will display a banner that ensures that staff are aware of this from the moment that they open the record. From here, we can move into scheduling. Appointments and therapy sessions are created inside the episode. This includes anything from a community nurse visit to a psychology session, physiotherapy intervention, or a full MDT meeting. When you create an appointment, you can schedule it as in-person or remote. If you pick remote, CE integrates with Microsoft Teams and automatically generates a Teams link, which saves your admin time and avoids mistakes. For repeating sessions like weekly counseling or recurring community visits, you can set a recurrence pattern. At any point, staff can open the patient's account directly and move to the calendar view. This gives a clear chronological view of all of the appointments associated with that individual, allowing clinicians and administrators to quickly understand past visits, upcoming care, and how different services are coordinated around the patient. This keeps the patient schedule properly organized, visible, and easy for the staff to follow. When an appointment is created, we can trigger automated notifications to be sent out via SMS or email, either to the patient themselves or to their next of kin, depending on preference. These communications can be fully tailored, both in wording and timing, to ensure that they are appropriate and sensitive. In addition to the initial notification, reminder messages can also be configured to go out automatically. For example, a day before the appointment or an hour beforehand. This helps reduce missed appointments while removing the need for staff to manually follow up. At this point, it's also worth noting that we can extend this experience further through a self-service portal which can be built using Microsoft's Power Pages. This would allow patients or carers, where appropriate, to securely view appointments, reschedule visits, submit forms, and even request or manage bookings themselves, all while keeping staff fully informed with the clinical management system. Now let's talk about safeguarding, because this is a major piece of hospice governance. At any point during the patient's care, if a staff member identifies a safeguarding concern, they can raise a safeguarding case straight from the episode. They choose the category, for example, neglect, domestic abuse, financial exploitation, concerns around family conflict, concerns about carer breakdown, etc., and then they document the concern. They can add external agencies involved, attach documents, record actions that need to be taken, and the outcomes of those actions. Each safeguarding concern is stored as a separate case but linked to the patient. Access rights can be restricted so only the right staff see it, and because everything is time-stamped and auditable, the hospice can demonstrate to regulators that concerns were raised, tracked, and resolved correctly. Alongside safeguarding, the system also has structured support for incident management. If something happens, such as a fall, a medication issue, equipment problems, or unexpected deterioration, staff can create an incident case right from the episode. They can set the severity, assign an investigator, document what happened, upload notes or evidence, and record the resolution once the investigation is complete. These incident cases give your governance team a single, organized view of everything that has happened clinically, without the risk of paperwork being missed or separate spreadsheets being used. As we continue through the episode of care, eventually we will reach a point of discharge, and that may be because the patient has sadly passed away, or because they prefer to return home, or because they are being transferred to another hospice or hospital. In CE, you can select the care outcome, and the system automatically generates a discharge case. Inside this, you document your reason for discharge, the patient's destination, and any other actions required from the team. This ensures the discharge is handled cleanly, consistently, and with proper documentation. This allows the team to record the reason for discharge, next steps, and any onward arrangements. It's also important to note that all related subcases linked to this episode of care are visible from the same patient account. This includes everything from bereavement support and safeguarding through to counselling, discharge alerts, and incident records. By opening the original referral and navigating to the Case Relationships tab, clinicians and administrators can see the full picture of activity around that patient in one place without having to search across multiple systems. In situations where the family needs bereavement support, and this is of course a central part of the hospice care, CE handles this sensitively and efficiently. When you indicate that bereavement support is needed, the system creates a bereavement or counselling case linked directly to the appropriate family member. This case can then be used to schedule counselling sessions, follow-up calls, group sessions, or any other support your hospice provides. It gives your family support workers a structured space to record how the family is coping, what interventions have been made, and whether further support is needed. This creates continuity between clinical care and family support, ensuring that nobody is overlooked after the patient's care ends. Before we close, it's important to highlight how all of the information captured throughout the patient's time with the hospice can be brought together for meaningful insights through Power BI reporting. Every interaction, from referrals and assessments to appointments, inpatient stays, safeguarding, counselling, and discharge, contributes to a rich, structured dataset. Using Power BI, we can build tailored dashboards for different teams within the hospice. For clinical teams, this might include visibility into caseloads, referral volumes, response times, and care activity trends. For finance teams, dashboards can focus on funding utilization, cost of care, inpatient occupancy, and service demand. For senior management and trustees, high-level views can bring together operational performance, service pressures, and outcomes in a single, easy-to-understand format. The advantage of Power BI is that these dashboards are live, interactive, and always up to date. Users can filter, drill down information, and explore the data without waiting for reports to be manually compiled. This supports better decision-making, stronger governance, and clearer communication across the organization, ensuring that insights are based on real-time information rather than retrospective analysis. Now let's highlight the long-term strategic value of building this on Microsoft CE. You're not just implementing a clinical workflow tool, you're adopting a platform that can grow with you. If you want to connect fundraising, donor management, gift aid, retail shops, volunteering, event management, sponsored runs, and other community outreach activities, all of those modules already exist in CE and can be added as the hospice grows. If later you want to bring finance onto the same ecosystem, Microsoft's Business Central can be integrated seamlessly. And if you decide to deepen NHS integration with GP Connect, ERS, or Spine data, CE can be equipped with that for the future phases. The core clinical system you're seeing today becomes the foundation for a fully unified hospice platform. So what this demo shows is a system that handles the full hospice journey, starting with the referrals arriving digitally, detailed information being collected without duplication or manual entries, the triaging process, the clinical assessments and care records being maintained in a structured way, the different appointment options, safeguarding and incident reporting done in a clean way, and discharges and bereavement support managed with continuity. And governance is ensured at every stage. It gives your clinical team structure, your admin team's efficiency, and your governance team's oversight, and gives families a smooth, compassionate, and coordinated experience right from the moment the referral is sent to the final stages of the support. Everything is designed to support safe care, strong governance, and smoother communication among the people involved. Thank you so much for watching. If you have any queries, please reach out to the sales team at IntelliSenseIT.com.